Are we there? Oh, I think there's somebody that's not on mute. Oh, that feels better now.
The recording started for you, Rachel.
Thank you so much. Okay. So what's important really is to give a sense of how we've come to this point. And there has been a piece of work going on for quite a few years, but since COVID and sort of the last 2 years, that development and transformation for adult mental health, and really looking at how do people access help at the right time for them in the right place. And the NHS, councils, charities and community groups have been working together to look at how those improvements can be made in order to better meet the needs of people. There was a working title, so some of you in the call who may have come across conversations may have heard of an acronym called MHIC, which was the Mental Health Integrated Community Care program, and it's now has that name called Access Wellbeing. So that is the transformation program for mental health. And Access Wellbeing, really, the key aims is to have that right support at the right time in the right way, so that people access what they need at the right time for them in a very person-centered way. There is no wrong door approach, the concept being that whichever space someone may go into, they can get connected in to that support, and that's really key. So there are 3 levels, and at the moment, again, terminology hasn't necessarily been completely ironed out, because from a internal facing conversation, you can call it certain things, but from a public perception, it doesn't necessarily work. So at the moment, there's been an area called the universal offer, and then there's a universal plus and a universal plus plus. Universal offer is that community offer, looking at that preventative space, looking at that early intervention, very much around those voluntary community groups that provide something for people at that right time for them. So it is very much about people not having to necessarily go to a GP and then having to wait in a line for access to support. It's about, let's look at what is that holistic level of support that works for people at an earlier stage. So there was a drive across nationally to transform mental health support, and in Dorset, they worked in a really with co-production, working with across the sector. So there was local authority, NHS from different areas within the NHS. There was voluntary and community sector organisations, people with lived experience, all part of the determining what does that model of support look like. And so it's been a very co-produced piece of work. And the phase one was around that developing what their values and philosophy, and looking at that overarching model, as I've mentioned, this universal, universal plus and universal plus plus. Working with a mix of groups to consider different needs and explore how teams can work together. And now we're in phase 3, which is launching of the pilot hub sites in Poole and Weymouth. And this community wellbeing and mental health fund being part of that phase 3, launching into activities to support that mental health transformation at that universal level. So there are 2 tested concept sites currently. One is in Poole in the Dolphin Centre, and one is in Weymouth in a place called Hope House. Both of those hubs are led by voluntary and community sector partners. In Poole, it is led by Prama and Help and Care, and in Weymouth, it is led by the Lantern Trust. And it's very much those voluntary community sectors working alongside the statutory partners, and very much so with that voluntary and community sector group. It is about coming in, though Poole particularly, Weymouth will become an open access space in time, but Poole is an open access space. People can just pop in. It is just for anyone to come in and have a conversation. It's going to, and there is a new workforce, wellbeing coordinators, that are in those tested concept sites. And in time, there are going to be about 60 to 70 of these wellbeing coordinators across the whole area of the geographic Dorset, and that will be they would be in trusted spaces, so community spaces, as well as hubs. If more hubs are developed, they will be outreach, so that they are connecting in with people in the places that those people go to. And it's very much about supporting them with a wellbeing plan if that is necessary, or connecting them into other support if that is what is needed. It's basically making it time to listen to people and finding out what they need and how they can connect to what they need and support them in that connection if that's required. And it's really, like I said, accessing support from the breadth of the system so that people can receive the support and guidance that they need. And I suppose the other thing to say about the universal space is that real acknowledgement that we know, because you are working in that sector, people have a range of complexities that impact how their well-being is. And whilst we know there may be a diagnosed mental health challenge, it actually often is life that is impacting people and how they feel. So very much that's where that universal offer really comes into its own. It's around, do they need support with their emotional well-being? Is it housing, benefits, or finance? Social connections, so are they isolated? Are they carers and in really challenging situation and feel disconnected to their community and need some support? Is it around education, training, and work to get them back into living that independent life? Is it about volunteering opportunities and many more aspects of support? So there will be some services that will be supported at the hub space itself, but it's very much about working across those trusted spaces that are already in use, some really vibrant community spaces that already exist. So I suppose what we're trying to say here is you are going to be part of that ecosystem of support. So people that are successful in this funding bid are going to be very much connected into that Access Wellbeing breadth of support and connected in with the hubs, so that they would know you exist, that they know that they can guide people towards you for activity. So it's part of creating an ecosystem of support that everyone is connected into each other. And that's what we would really like to see going forward. So that's given a flavour of Access Wellbeing. It's really weird talking to a screen and hearing nobody and saying it all. So I'm hoping that makes sense. But if there's any questions specifically around that and you would like to ask now, please do. If you are happy to wait to the end, happy to do that too. Okay, we will go on, and now it's over to Ellie.
Hi everyone. So I'm going to obviously talk about the fund specifically and hopefully help you to understand in a bit more detail what the panel will be looking for and give you a few hints and tips. We've picked up a lot from other groups about the most useful information, so I've now got so much to say. I'm going to try and be succinct, so bear with me. So we've got £1 million to spend, which is NHS Dorset money. It sounds an awful lot. It won't stretch that far. There is going to be high demand, but we'll do the best we can, obviously, to have a good geographical spread and different representation of different types of communities across Dorset with the funding as a whole. Hopefully many of you have already looked at the fund page and the application form, so you'll have a head start. There's 2 different types of grants available. The smaller grants are up to £10,000 for up to a year activity. Dorset Community Foundation, that feels like quite a big grant to us, so it's funny that I'm saying small grants. So those will be available right now with the 1st of March deadline for your applications, and there'll be a second round of those smaller grants of up to 10,000 in the summer. So do bear in mind if you're going for that size grant, that if you're not quite ready yet on the basis of what you hear today, you've got several months to work with CAN and to do some work yourself to prepare and be ready for next time. So that's a good option, especially for newer groups or for pilot projects that might not be quite ready yet. And then we're also offering grants of up to £80,000 in total over a 2-year grant period. We're looking for more established groups for that grant stream, so groups that have been delivering activity for at least 2 years. So it doesn't matter so much when you registered. You know, many groups transfer from being a community group to a registered charity at some point. We're not going from the date of your charity registration. We're talking about a track record. So if you've been delivering your activities, and we can see that for at least 2 years, then you would be eligible. Like most multi-year grants, you would have to report at the end of year 1 in a satisfactory way before year 2 is paid. So although it's a 2-year grant, there is that midpoint check-in with us. And it's worth saying that you don't have to have the same budget in years 1 and 2. We wanted to give groups lots of flexibility because some projects may need front loading. So if you're buying equipment at the beginning that would last over the 2-year period, you may need a larger grant in the first year. For many other projects, I imagine, if you see the work developing and growing over the 2-year period, you may want to have a higher budget in your second year. So we're leaving that very much up to you. What did I want to say? Yes. So lots of groups have asked, can they apply for both the large and small grants? The answer is yes, you can. We didn't want to prevent groups from being able to do that, but I really encourage you to just go for the size grant that is appropriate for your size organisation and for the piece of work you want to do. If you're a really large organisation where you need paid staff to run your activities and that's your model, then the 2-year grant may well be right for you. If you're a smaller volunteer-led group, that's running on, I don't know, 50k a year, I would say the smaller grant probably is the right grant for you. We are, as I say, we're going to be in huge demand, so I'm trying to manage the workload on both sides because you won't be able to receive both a large and a small grant. So if one of those options clearly is the right one for you, and you can talk to Can about that, I would probably confidently go for the one that's right for you. That's my advice, but you can apply for both. If you do apply for both, the way it will work is we will look at your large grant application first. If that's successful, we won't consider your small grant application. If your large grant application is unsuccessful, obviously then we would look and consider your smaller grant application. So that's how it would work. Next slide, please, I think, Rachel. No. So I want to just acknowledge quickly that I feel like this has been a long time coming with the NHS, and we're all really excited about this. And I feel like it's a proper acknowledgement that the voluntary sector has such an important part to play in people's well-being, and that they're offering things that the NHS simply can't and doesn't and isn't interested in delivering. But the voluntary sector activities are just as important. And I feel it's such an acknowledgement of that. So yeah, thank you to the NHS. And what we want to do is a really good job of evidencing the outcomes that we know you're all achieving for people, the difference you're making in those in people's lives. And I'm confident we can do that with this fund. So it is largely about prevention and early intervention. This isn't a funding programme looking to support people with severe mental illness. It's about catching people at an early point where there's an identifiable wellbeing mental health need. People are struggling, they don't know where to go. And the key thing is that we're looking to work with people whose mental health and wellbeing is likely to decline if they're left alone, where your intervention as a voluntary sector group can prevent that decline and can prevent potentially that person ending up needing an NHS clinical intervention. It's all about relieving the burden on the NHS by giving people the support they need before they end up in a GP appointment, a counselling appointment with a psychotherapist. And that's the really important key message. I suppose what I would say is that applications that will really stand out, because we're trying to argue that this is preventing future NHS interventions and appointments, projects that will stand out are projects that, yes, you can evidence that you're improving somebody's wellbeing and mental health whilst they're participating in their activities with you. That's obviously really important. To really stand out, if you can, and if it's relevant to your activity, if you feel that when they leave participation with your activity, you are leaving them with improved skills in maintaining their own well-being and mental health, so that they're more resilient, they know how to maybe manage or that element of self-care, that they're more able to look after themselves, to identify when they need support. You might be leaving them at a point where they're doing a regular activity that they weren't doing before, so they're maintaining that social connectivity. It may be that they're choosing to volunteer back in your organisation. I know for some of you that is a model that you can talk about. So if you're giving them tools where you can argue that in the long term they're continuing to be more resilient and to be living well within themselves in the community, then that's going to give you kind of extra weight to your application, extra weight to that argument that you are preventing a decline, preventing that burden on the NHS further down the line.
I really must.
Jo, could you just mute? Thank you. Perfect. So this is a fund for adults. Some groups have missed that, so do be careful. If you work with children and young people, this isn't the right fund for you. We're looking to address the needs of adults, so those aged 18 and over. If your organisation bridges that gap, so if you're working with people aged, 14 to 24, what you might want to do is, there's two options. If you have a piece of work that is specifically for your adult cohort, obviously that's the piece of work to apply for. If your groups are multi-age, what you could do is make a proportional application. So 50% of the people that you're working with are age 18 over, you could ask for 50% towards your cost of that activity. Hopefully that's helpful. Again, obviously you can have all these conversations with CAN. The other thing that it's important to say is that it is about non-clinical activities. So as we're saying, this is about the NHS acknowledging that the voluntary sector are doing something different and something at an earlier stage, that early prevention agenda. So unfortunately, clinical activity is not eligible. And the big one, I think, for the voluntary sector is one-to-one counselling. So if you're offering one-to-one counselling with trained counsellors, therapists, that is seen as a clinical intervention. So it's not eligible for this fund, unfortunately. But I know that some counselling organisations offer a range of follow-on support. So after a period of one-to-one counselling, you may have a group setting or a community-based activity where you're helping people as a second stage, of their recovery. That type of activity may then be eligible because it's not seen as clinical one-to-one counselling. So just be careful around that definition of what is clinical and what is non-clinical. And if you're not sure, do speak to CAN, and we've got a contact with the NHS we can check with if there are any grey areas. We can support ongoing activity. Please, it's not one of those funds where you have to invent something new. I imagine there probably are some new projects or groups wanting to try something for the first time. That's fine. But equally, if you want to receive funding to continue a really well-evidenced activity that meets the criteria of this fund, that's absolutely fine as well. Next slide, please, Rachel. I don't want to talk too long about eligibility because it's all on the website and CAN are there to help you. We're relatively straightforward and it's similar to all of our funding programs, so most of you will be used to it. You don't have to be registered as a charity or a CIC, etc. with us. You can simply be a more informal community group, but we would expect that you and all groups have a governing document, a bank account in the name of your group with multiple check signatories, and at least 3 unrelated people running the organisation. So that's the basics really. Your safeguarding policy, your EDI policy, your latest accounts, etc. If you're not sure that you've got those documents or that they're as they should be, obviously that's where CAN come in, and you can work with them to make sure that you've got all of those that documentation. Just a quick word on national charities. We don't support national charities, which is consistent across the Community Foundation network. There are lots of national charities with fantastic local work going on, that are often led by local people in Dorset. But regardless, if the governance and responsibility for that Dorset piece of work goes back to one national charity number, unfortunately you wouldn't be eligible for this fund or for most of our funding programmes. We're looking for locally based organisations that largely are based in Dorset and are working in Dorset. We can sometimes support regional applications, so perhaps if you're working in Somerset, Wiltshire and Dorset, that might be okay. You would be seen as a lower priority, but you could apply. But if you're delivering in kind of London, Birmingham, you know, other parts of the UK, not in the southwest, it's likely you would be ineligible. So again, talk to Can if you're not sure about that. Next slide, please. There are a few exclusions. Again, I don't want to talk through it all. It's all available for you. Just a quick word on faith-based organisations. We're happy to fund faith-based organisations. We do this a lot. We funded a lot of churches actually in the last couple of years because many churches are starting to offer, you know, food bank type activities and other community activities. What you need to do is help us to feel confident that the activity we would be funding is not attempting to influence people's religious choices. So we find that some faith-based organisations are delivering something that is worthwhile for the community, but on top of that, they do see it as an opportunity to talk about their faith. If that's you, this isn't the right funder. We're not the right funder for you. There are other faith-based funders where that wouldn't be a barrier, so you need to look for them, and can hopefully help you to signpost appropriate funders. If you're offering a community service that's open to everybody and that is not connected to your faith activities, where you're not talking about your faith activities as a matter of course, then this could be the right fund for you. And we just look for ways to be confident about that. So I would check your website, for example. I would check what you're saying publicly about the service that we're funding. And obviously in your application, we're looking for that confidence that it's not about a faith conversation during the activity. There was one other thing I wanted to say. Oh yes, so we do say under restrictions that groups with more than 12 months unrestricted reserves, we're talking about cash reserves, are usually not funded. If there are any new or small organisations in the room that don't know what that term means, it's really helpful in your accounts to show your reserves, so the money that you've got left at the year, to show which proportion of that is unrestricted and restricted. And most funders look at this figure, but we're looking for the unrestricted figure. So if at the moment you're not separating that out, it's a really useful thing to do for all funding applications and just for good practice as you continue to develop, you know, your governance. So if you're not sure what that means or how to do that, do speak to Can. It's a really worthwhile conversation to have. Next slide, please, Rachel. So these are the governing documents that we ask you to provide when you apply. It's pretty similar with most funders, really. Just a couple of things I wanted to say. We do ask for annual accounts, but I imagine there probably are some new groups in the room that haven't yet completed a first year of activity. Because you don't have annual accounts, what can be really useful to send us instead is any records you've been keeping of your income and expenditure so far, even if it's just on a spreadsheet, you know, really basic. It still helps us to see that someone's keeping a record and, you know, and being, you know, responsible about the money that you're receiving and how you're spending it. If you've gone one stage further and you've done a full budget for your next 12 years of activity, which some groups do, that's really useful to see as well, because it gives us an idea of where you're hoping to get your income from and how you're hoping to spend in the coming year. So they're two good things to send if you don't have annual accounts. I think that's all I needed to say really on that slide. Again, Can are there to support you if you're not sure that you've got those supporting documents correct. So this is probably the most important slide. There's a lot of information on it. Hopefully most of you have already read this on the fund criteria. It's probably the most important section to understand before you start applying, because this is what the panel will be looking for and will be assessing. So as you can see, we're talking about early intervention. We're talking about improvements to wellbeing and mental health, helping people live well for longer, reducing the need for NHS appointments. So we've already covered all of that. And again, we're talking about the longer term outcomes that we hope you're able to describe, that you believe you're achieving, or that you can evidence. So empowering people to build resilience, to find their own solutions and support strategies in the future, helping them to lead independent, happy lives. And again, we've spoken there about one way in which you might feel that you're strengthening somebody's resilience is because they're better connected and they're contributing back to their community in some way. That can be one way of that ongoing support being there. And it's important to point out, I think, because I think this can be missed by applicants because we're using the language about early intervention and prevention. Yes, obviously we do mean people who are experiencing a wellbeing and mental health need for the first time, absolutely. But we have also made room for people who are in recovery from a mental health episode and people who potentially have a mental health diagnosis. So again, bear in mind, we're talking about helping people who perhaps are at risk of a mental health decline. We're wanting to prevent that decline, prevent future NHS clinical intervention. So someone who's had an NHS clinical intervention because of a mental health need, who is then expected to recover in their community, we know that sometimes you can be left with not very much and not know how to kind of move forward. So we feel that voluntary sector organisations often do help those people to live well in their community, to continue their recovery. And we believe that you help them, you prevent the likelihood of them potentially declining again and needing another NHS intervention again. So we have made room for projects that work with those individuals and also individuals who have a mental health diagnosis. So as I remember Mark saying in one of the previous events, you know, many people are seeing a psychologist, a psychiatrist, perhaps, you know, once every couple of months, and that's the only kind of check-in they get. Whereas again, voluntary sector groups can be an important part of that person's ongoing self-care, the management of that health condition, staying well and preventing decline. So we are making room for projects that are working with those individuals as well. Again, it's not about people who are in a very acute level of mental health need, you know, suicidal ideation or complex psychosis. We're not talking about those individuals, but if it is people who just need a bit of help to stay well, then absolutely it includes them as well. I think the really important thing I want to say about what the panel will be looking for is that there are lots of groups that are providing activities that help everybody's well-being, and it's an open for everybody. Everybody can come along and take part in this activity. It's really good for your well-being. Those types of organisations are really valuable, but they're potentially not right for this fund, because what we're looking for is where we can confidently make an argument that, again, we are supporting people whose health is likely to decline and we're preventing that need for clinical intervention. For that reason, we're looking for groups that are able to make a case that they are able to identify and work with individuals who identifiably have a wellbeing mental health need. They're really starting to struggle. They perhaps have become very lonely, very isolated. They're starting to feel very unconfident in their relationships, in their work, whatever it might be. There's something identifiably there where there's a need to support that person and to make sure that they're not continuing to decline. So if you're an open to everybody type organisation, I would encourage you to talk to me or to Can about other funding programmes that might suit you. This particular fund, we are looking for slightly more focused projects where you're able to say that you're working with people with the early stages of mental health struggles and needs. And you can do that in lots of different ways. Obviously, an obvious way to help the panels feel confident that you are working with those individuals is a more formal referral route. And I know some people in the room have those in place. So you might receive referrals from social prescribers, you might receive referrals from other NHS bodies or from other voluntary sector groups, from schools, or actually not schools in this case because we're talking about adults, but from other agencies, perhaps social services that are able to identify people that need your service. Obviously, that's fantastic. It doesn't have to be a formal referral route. I've seen lots of really good examples of groups that pitch their activities really well, and they might be promoting their activities through a local library, a village hall, even social media online. And if it is clear that those activities are being pitched for, you know, are you starting to struggle? Do you feel lonely? Would you like to meet other people in your community? You know, we're a real safe space for people who are struggling. We'll take care of you. You know, that messaging is not suggesting that this is an open for everyone activity, but that it's a focused activity designed for people who are starting to struggle. And that might be a perfectly reasonable argument to say, you know, we're working with those individuals. It doesn't have to be formal referral routes. It's simply up to you to describe in your application how you're reaching those individuals. So some examples of the types of groups we would hope to see applications from are sort of facilitated support groups for people with shared experiences. So it might be, you know, people in drug and alcohol recovery, people with a particular diagnosis, so dementia projects, for example, people with other shared experiences. We would hope to see kind of green social prescribing activities, support groups for carers, groups using the arts or sports or music to help people with their well-being and mental health. It kind of doesn't matter to us really what mechanism you're using, as long as you can make a case that you're working with people in need and that you are achieving those improvements to well-being and mental health. If you do that through music, sport, craft, you know, whatever works for those people is fine. And perhaps support groups for parents experiencing challenging circumstances, social groups for people who are feeling isolated, where you can support them to come out of their homes and connect again, community sheds, lots and lots of examples of the types of things we're looking for. One other important conversation to have with you, and this has come up at the other events, is that what can be challenging, I think, for us when we're distributing funding as much as anything else, is that pretty much anything a voluntary sector organisation is doing is going to be able to say, you know, we believe this is supporting people with their well-being, because everything affects well-being, doesn't it? You know, if you're going on a financial resilience course or receiving a food box, it's likely that will also impact your well-being. If somebody's supporting you with a housing need, it's likely that that will support your well-being. Pretty much everything does. For this particular fund, because the number of applications is going to be really high, we're looking for work that is really focused on well-being and mental health, that has been designed for that particular outcome. So if in your heart of hearts, if you are a food provision organisation, for example, and really, you know, your main outcomes that you feel proud of are about helping people to be financially resilient, helping to move them out of poverty, back to employment, all of those things. If that's who you are, and you were to make an application describing those things and then saying, you know, well-being is one of our outcomes, it's probably unlikely you would be selected. Whereas, even if you are a food provision charity, if you're able to say, we recently designed this piece of work that is specifically supporting people who we feel have well-being and mental health needs. So we're doing all of this stuff around food, but this particular piece of work has been especially designed for people who need well-being mental health support. That application would stand a higher chance of success because there's a more focused design element around well-being and mental health. It's one of those that is going to be a grey area, and that's why we've got CAN to help support you. But if you're providing a holistic kind of service where you're doing lots of different things for individuals, the NHS will want to hear about that. They'll want to know that you're also helping that person with their financial resilience, their housing, their employment, because it is part of the picture. But the crux of the piece of work that you ask us to fund needs to be clear that it is a wellbeing, mental health focused project, if you like, and that will maximise your chances of success. I think that's probably as clear as I can be. If you feel you sit in that space, again, that's why CAN have got the ability to have one-to-one conversations with you to help you to navigate some of these nuances. Next slide, please, Rachel. So there is, amongst the examples I was giving you of the types of projects we're hoping to fund, Obviously, we do really welcome applications from groups working with communities that experience health inequalities. So if you're not familiar with what that means, it's sometimes in the NHS language, it's sometimes called inclusion health groups, as a phrase I've come across. Essentially, we're talking about communities that tend to experience poor health outcomes because of their identity or their socio-economic situation. So it would include low-income households, it would include ethnic minority groups, people at risk of being connected to the criminal justice system, people who are drug and alcohol dependent, and other factors. And there's a link on the webpage to some more information. But if you are working specifically with a group that experiences poor health outcomes, then applications are particularly welcome. You don't have to be, you know, obviously every group is different, but we just want to sort of say out loud that those applications are particularly welcome. What else did I want to say? Oh yes, it's important to point out, because groups will always ask, what can I ask for? What can I spend the money on? I'm happy to say the NHS have been really open-minded about this. So really there aren't any particular restrictions. If what you put in your budget matches what you're going to deliver, you know, you need to spend it on those items in order to deliver what you've described. Pretty much it's fine. So if it is capital costs, pieces of equipment, if it's staff costs, volunteer costs, venue hire, refreshments, pretty much anything goes as long as it matches what you've described, which is great. There are always questions about core costs. What I would say on core costs is, if the entirety of your organisation and what you deliver is about wellbeing and mental health, so if that's you as an organisation, you're a mental health organisation, then I think potentially you could make an application for your general core costs. You would need to link that obviously to the people you're working with, the outcomes and all of those things. But if everything you're doing is around mental health wellbeing, then yes, a core cost application would be acceptable. If you do a range of different things as an organisation, you're probably better off asking for funding for the piece of work that best fits this fund. But within that, you can ask for a contribution towards your overall core costs, your organisational costs. So you could put in all of the costs of the specific activity that needs funding, and then you could say we're asking for 10% towards our overall organisational costs. You know, if you do have a premises or an administrator or your insurance, all of those kind of more general things. It's up to you to be proportionate. So don't ask for 50% towards your core costs if the activity is actually a much lower proportion of what you do. And again, can help you with that. But that's two different ways that you can ask for contributions towards your core costs if that's what's right for you. I think I've covered everything else that I wanted to say on that slide, so we'll move on to the last one, I believe. Rachel? Yeah. So I wanted to go through some various top tips. This is about this fund, but it's as much about any fund that you apply to. And I've done a similar kind of presentation when other funders have been in the room, and they've often said, yeah, that's exactly what we feel as well. So hopefully this is just helpful for your learning around making funding applications, which is a big learning curve, isn't it? It's a definite skill that you hone over the years. So there's always a question on application forms, isn't there, about what is the need for your service? You know, why is the service needed? I think the mistake some groups make in early days often is to start quoting big national statistics to try and prove that the problem that they're addressing exists. Do remember, you know, our panels are really intelligent people who care about their communities. You know, that's why we're working for them. They often know this. You know, we don't need to be told that, you know, 1 in 3 people, you know, may have a mental health need in their lifetime, or, you know, we don't need to be told about the stats about national homelessness. It doesn't really add anything to the knowledge of the panel or our understanding of your group. The information they don't know is what is happening in Gillingham, particularly, what is happening in Portland, particularly, what is happening in your community that is just a new and emerging need that's actually just started to become more apparent in the last 12 months. What are the numbers of people on your waiting list? How many people are you having to turn away because you don't have the funding you need to add in that extra Thursday evening session? You know, all of that information about your group, your experience of that particular issue, that's the really interesting stuff. And often that's better evidence that we should be funding you than a national statistic, especially for a community foundation, because we're all about Dorset. We are a local funder. And we want to learn as much as we can about Dorset. We learn so much when we read funding applications and when we visit groups about the nuances, you know, that exist in our county. So don't forget that local evidence can be as strong or sometimes stronger than just describing what homelessness is or you know, whatever your theme is. Sometimes if you're working in a very, very nuanced area, which you feel, you know, there is a lack of awareness around, sometimes those bigger national statistics or pieces of information, you know, can be valuable. So I'm not saying don't do it, but you know, it's more valuable, I think, if you're working in a very, very niche area where panels are less likely to understand what you're talking about. But generally speaking, that local evidence is really key. And then there's always a section on application forms that asks, what are you going to deliver? What are you going to do with the grant? I always say, sometimes we do see applications which give you a lot of fancy wording and waffle. I hate to say it, but sometimes from paid fundraisers, we get this more often. And sometimes we're left feeling, but how many sessions are you running a week? How long does somebody stay with you and with your activities? How do you manage the endings? And we're kind of left not really understanding the nitty-gritty of what our funding will allow you to deliver. So my advice is always get somebody that you trust, that doesn't work day to day in your organisation, to just proofread the application, because they'll probably pick up the same things that we are. You know, you haven't actually said how many sessions somebody receives. You haven't actually said how many people are in that group. Is it a group of 4? Is it a group of 20? You know, all those basic details. Those of us that have written funding bids again and again and again, it's so easy to miss out something really basic. And so do just make sure that you've got that detail in that section, and proofreading can be really, really helpful. For this particular fund, there's a specific question about how you're going to reach the people that you're describing you want to work with. And I think largely I've covered this. This is important for this particular fund because, you know, we're wanting to confidently support projects that are working with people with an identifiable need. Again, it doesn't have to be formal referral routes. It's up to you to describe how you're reaching and working with those people, or how you plan to. What I would say is that if you are going down the route of referrals or signposting from other agencies, please don't name an agency if it's not genuinely in place, because we may check or we may know. We are quite knowledgeable, you know, we've got a good relationship with many groups. If you've just had one conversation over the phone with somebody and that's as far as it's gone, it's probably not strong enough to put in a funding application. The strongest way, especially if you're providing something ongoing, those routes are probably already in place, and so we can see that. If it's a new piece of work, the strongest thing you can do, if you can, is to say, we've already spoken to this agency, they've come to see us, they know all about our service, and they've identified that they think there are 10 people that they're currently working with they would like to refer into our service if and when we get funding. You know, that's the best way to feel really confident that this piece of work is going to happen, that you are able to reach those individuals. So again, if you're doing something new and you're not really at that point yet of having a good mechanism to reach people in need, you might want to wait for the second round of those smaller grants in the summer, so that you can work on developing those relationships. Ask Can who you should be connecting with, and then have a more confident application in the summer, is what I would say on that. There's also, for this particular fund, a question around the appropriate level of expertise of the people that are delivering your activities. again, we don't want to scare people that this has to be a very high level of, you know, professional counselling qualification. It doesn't necessarily need to be. We see a lot of groups that pitch their activities towards, you know, are you feeling lonely? Do you want to feel better connected? Are you, you know, feeling low? You know, we want to help you connect to other people in a similar position, and we want to provide support. For that type of activity, you know, lived experience can be really appropriate. You know, if your facilitator simply has a lived experience of those struggles themselves, but are now in a robust, good place to help others, that can be really appropriate on its own. Some groups that we see do a level of training, so they might do a mental health first aid course. There are other kind of courses that are slightly longer that people can do. There's a whole range of different things that would make somebody the right expert to deliver your activities. And I can't tell you what we would expect for different levels, but it should be proportionate to who you're working with and what you're delivering. So for some of your activities, you perhaps would need a high level of perhaps professional support. For other activities, a lived experience, somebody that's done a bit of basic training would be absolutely fine. But we're asking so that panels can feel confident that you do have an appropriate level of expertise to work with the people that you're describing. So hopefully you'll understand why that question is in there, and it's really up to you to make a case that you've got that right. And if you want to upskill your volunteers or potentially possibly staff, and you feel you want to send them on some sort of basic training course, anything like that, that's really welcome to include in your funding bid, you know, because often there are, you know, costs associated to doing those types of courses, even if they're just a day's course. So you can absolutely put that in your funding bid. That's absolutely fine. Yes, so outcomes and measuring outcomes. So again, this is going to be on every funding application you ever write. We all know this. Funders, we're now obsessed with measuring of outcomes. What I always say is that this is the bit that usually genuinely tugs at the heartstrings of our panels and can make the difference with whether you receive funding or not. Applications that spend the majority of their time talking about the issue. Gosh, we live in such a difficult world. People are really struggling. They don't know where to turn. You know, their lives are likely to get worse. Oh gosh, you know, it can be quite fatiguing when you're reading application after application and just reading all of these really negative, you know, problems that exist in our society that largely we often are very aware of anyway. And that can become quite negative and quite fatiguing. Whereas the applications that actually spend the majority of their time talking about, you know, this is the difference that we can make. This is how people present when they first come to us. When they're exiting our or, you know, participation of our activity, this is where they are in their lives. This is what they've achieved. This is how good they feel. This is what, you know, they're going to go on to achieve in their lives that they couldn't before. Those positive stories, they're much more motivational in terms of wanting to award funding. So, you know, don't forget that it is really important, and it is usually the part of the application that really makes you stand out and makes panels feel really good about awarding funding, because they think, yeah, this is what we want to be part of, this difference, this outcome, this impact. So, you know, it's not something that you should kind of do because, you know, funders require it, if you like. It's not a tick box exercise. It is really what's going to make your application stand out. Again, just to remind you, with this particular funding programme, if you can talk about the outcomes people achieve during their participation, and then the outcomes that you believe you're leaving them with on a more long-term basis, that will be a really strong application. And of course, CAN are really good at supporting groups to learn how to measure outcomes and how to measure impact, which can be difficult to navigate if you're new. But I think as funders, we used to be in a position where, you know, if we had a couple of really good case studies, you know, in an application, you know, we'd feel confident to fund. But I think competition is just so high now. You're just wanting to give the panels the maximum level of confidence that what you're doing really is going to make a difference in people's lives. So if you're working with 50 people and we've got one case study, you are left thinking, what about the other 49 people? So I think you do need even smaller groups, and it is proportional to what you're doing. You don't have to have, very complicated mechanisms, but you should have a tool that enables you to attempt to measure the difference you're making to people for everybody. And you may not get everybody responding to your request for feedback or however you do it. But if you're at least able to say, I don't know, 70% of people responded to our request and this is what they told us. And usually we find it is a large majority of people who really have, their lives have improved in certain ways. And that just gives the panels an extra level of confidence. It's not just about one case study and what happened to the rest. You are attempting to measure across the board. And again, it doesn't have to be hugely complex. This isn't about handing everybody a form when they come to every weekly lunch club. It's absolutely not. You might do 2 focus groups in a 12-month period where you extend, if normally your session is 2 hours, you might say to your participants, just twice a year on these 2 dates, we're going to make our session 3 hours. We're going to give you cake, whatever works for you. And we're just going to spend the final hour talking about how you found taking part, tell us any feedback you have. That's a really good mechanism. And there's lots of different ways of doing these things. And that's what can help you with. But do make sure you're able to describe how you're going to measure those outcomes, because that will be important, particularly for this particular fund, because we really want to evidence to the NHS that funding voluntary sector organisations results in positive wellbeing mental health outcomes that reduce burden on the NHS. We want to be able to evidence that, because then they're more likely to extend this or to give us more funding to help you in the future. So it is really important, and you'll find in the application forms that there is, as you can imagine, that there's a box where we ask you about the outcomes that you're achieving, and you can just describe that. But we are asking you to select a minimum of 2 outcomes and 2 indicators for those outcomes from a set list. It looks fairly rigid, but we do need to be able to show across the breadth of this piece of work. We need to be able to evidence to the NHS, what's been achieved, and they're used to getting lots of, intricate data, from within the NHS. So we want to be able to, as much as possible, to provide a set of data that's really strong. So that's why we're asking you to select from a set list, so that we've got something we can pull across the whole piece. Obviously, if you're measuring outcomes above and beyond, the minimum requirement we're asking of you, please still tell us those outcomes in your end of grant reporting. Please do more, but we're asking for a kind of minimum number. And if you are a group that has that holistic view, and you're working on somebody's housing, their food, or other things along with their well-being, you will find that you can select some of those outcomes and indicators as well, if that's right for you. Because although the work needs to be focused on well-being and mental health, as we've already said, the NHS do want to know if you're providing other elements that tie into that individual's well-being as part of the picture. So you can select those other more practical outcomes as well. The very last thing I want to say is that we do ask you in the application form how, why or how you believe your activity does prevent burden on the NHS and does prevent additional NHS clinical appointments. It's the hardest thing to evidence, isn't it? The prevention agenda. It's really difficult to say this person would have ended up in a GP appointment if we hadn't have identified them and worked with them. It's very, very difficult to evidence, and we're not expecting you to. What we are asking of you is that you are able to evidence other wellbeing mental health outcomes. So what you can evidence is that somebody's having less panic attacks, that somebody is more confident in their workplace, that somebody literally tells you that they feel better and that they feel that their well-being is improved. You can evidence that they're better connected to their community than they were previously. You can evidence that their personal relationships or their environment at work has improved because they've got more confidence and more social skills. There are lots of things you definitely can evidence, and I know that you do that. And our job as Dorset Community Foundation will be to take all of those outcomes that you can evidence and to make an argument that because of all of those achievements, therefore, people are less likely to seek a clinical intervention in the future. So we're not expecting you to necessarily evidence that people aren't going to, seek an NHS appointment. But we would expect in your application for you to be able to reasonably describe why you think you are relieving burden on the NHS. But it's not evidence-based, so don't worry too much around that. As long as you can make a reasonable case in your own words, that's all we're expecting, because evidence in prevention is obviously extremely difficult. There's probably lots of things I've forgotten to say, but I'm going to stop talking there because we want to make room for the Q&A, and hopefully, I don't know if Mark's joined us, Rachel, but hopefully Mark will be able to be part of that.
Yeah, there's a couple of slides left just to reiterate what it is that we can support from the CAN perspective, because we are we're not being part of that panel and that decision-making process. We're here to support groups at that earliest. So looking at that list, really, again, I'm not going to go through that list in that way, but as Ellie has said, anything that's come up around that eligibility or questions about having documents in place, particularly if you're a new community group that are coming, I've got a great idea and wanting to get started, it's really important to understand what it is you need in place in order to be funding ready. Positively, in terms of the £10,000 grants, for example, if you wanted to go forward for the grant this time, but you were unsuccessful in this round, we could again support you in terms of the next round and being more ready for that. But that funding ready list is really clear. And if there's anything there that you're like, I don't know what that includes, then that's definitely worth a phone call to find out, or an email to just sort of clarify what those documents or information may be. And in terms really of the enhanced offer, so in the past we will have supported with application, funding ready and getting people ready. And then the other element of support that we want to do is work with groups past the point of success of achieving the grant. And as Ellie says, one of those areas around measuring outcome and measuring impact, is about supporting groups to put some tools in place. What can they do in order to feel that they're doing this in good time, getting things ready at the beginning, making sure that they're measuring as they go, so that it's not we'll come to the end of the year and we've got to work out how we can demonstrate impact. So we want to support organisations in their implementation of their project, making sure that they are realistic, that they're robust, and also want to support in that collation of data. That could be through training, through toolkits, through webinars, one-to-one support, one-to-one visits, meetings, etc. So it's what works for you. So it could be it's an online conversation, it could be it's a phone call, it could be that we are meeting up with you. The other element that we want to move forward with is facilitating a network and a collaboration of groups once those that are successful in that funding pot, to bring people together to share where they're at and support and peer support around the continuation of their projects. So that's something else that we would be looking to do. And finally, really to just outline that if you are a member of CAN, and many people on the call may be a member of CAN already, it's free to join if you're currently not a member. And as part of that membership, you have access to this support all the way through the year. And you also have access to training. I just picked this one up off the website before when we did the presentation to show that there is a training module coming up for outcomes and measuring impact, the date of which is later than the application on this occasion, but it's still that information. And these programs and training come up on a regular basis. So They are only accessible if you're a member, but as part of this, obviously, as part of this fund, we're supporting those organisations anyway. But I think it's just worth considering the level of support that you can get, and hopefully you can attend that on the 13th of March and learn a bit more about those useful tools and tips and tricks you can have around that. So I suppose all that's left to say is, and it's on the website, on DCF's information around the fund, but also just to reiterate then, so anything that is a query related to the application process, absolutely still contact Ellie. But if it's anything around the content, around the funding ready, about the support, around how does what does that are you meeting the needs of what the fund is requesting, that's a conversation with one of our team. We have 3 people that are supporting this, Louise Stewart, Marie Pandolfo and Becky Stalker. And so because there's 3 people involved in that, we're going to work through an email address called grantsupport@can100.org. So whilst you might know Becky and Louise via their own individual email addresses, it would be really useful if we can put all information and queries through that email address so that we can make sure we can keep in touch with all of those people that would like to make an inquiry. So that's the end of our presentation on our information as is. So I'm just going to end the slideshow, and I'm also going to ask if Amy can end the recording at this stage.
Just wondering, actually, Rachel, before we end the recording, there's quite a lot of questions in the chat that I could whiz through, and obviously without saying who's asked those questions. So if you feel that can be part of the recording, it might be helpful because there's some quite good questions there. Yeah,
absolutely. So I'm just going to work out how it's very simple. Stop sharing. Brilliant. So I've stopped sharing now, hopefully. Yeah, if you want to go through some questions that you feel would be useful for everyone, and then once we get to people popping their hands up, maybe we cancel, stop recording at that stage.
Yeah, okay. I'll try and whiz through really quickly. There's a question about whether art therapy or music therapy would be eligible. I think if it's one-to-one therapy being delivered by a professional counsellor who happens to use art therapy as their mechanism, I think that would probably be seen as a clinical intervention. If it's in a group setting, I think it's much more likely that would be seen as eligible. But it might be one of those specific questions that would take back to the NHS just to make absolutely certain that you are eligible before you apply. But I think within a group setting, I would see that as community-based, and I would hope that would be eligible. We've been asked how many projects we're hoping to fund. Sorry, I didn't cover this. I should have done. So we've got enough funding to fund, I would say, 8 2-year grants. That's not many. Certainly, if everybody goes for the maximum 80,000, then it probably is 7 or 8 grants. You can obviously apply for less. You could go for 30,000 over 2 years, 15k year 1, 15k year 2. That would be fine. But those are the rough numbers for the large grants, and then roughly we would hope to fund between 40 and 50 of the smaller grants, and that's over both rounds. So we're looking at 20 to 25 per round.
I have actually also contacted Zoda and Sarah Webster with regards to that already and sent them the links for support. Certainly Sarah is based in Sherborne.
Right, thank you. Do wages count as core costs? Well, yes and no, really. If we're making a core cost application, then absolutely, that might count. If you're applying for a particular piece of work, you might have sessional staff that you bring in to deliver those particular activities, or it might be a payroll post. But yes, you can ask for staff costs. That's absolutely fine. Are we able to upload impact reports with our application? Good question, and you'll be glad you're here because this is quite a good top tip. As a general rule, we don't accept, or we wouldn't look at additional documents. So we ask for the documents that we ask for. You've got your application form. That's what we're reading. It's the fairest way of approaching this, so that everybody's got the same form, the same documents, the same word counts, and then we're assessing on a case-by-case basis. So if you send a 10-page impact report, we're really unlikely to read it because it's kind of unfair to groups that have chosen not to attach it. However, what we do sometimes see is that groups put a link in their application form. So some groups have lovely, 2-minute videos on their websites that might really bring to life what they're saying. If you were to put in the body of the application, there's a 2-minute video on our website that tells you all, more information, or it's in the words of one of our service users, please watch it. I probably am likely to watch it, and I think so are the panel, because if it's 2 minutes, it's 2 minutes. So that's my kind of top tip. Don't add additional information, it won't get read. But if you want to put a link in, if you want to say, it might be a written case study. There's a short written case study on this page of our website. We invite you to read it. Then we may well do if it's not going to take too much additional time. Can we see the NHS outcomes and indicators? So the outcomes and indicators on our form, they haven't been set by the NHS because currently the NHS are struggling to design what outcomes look like when you're talking about community-based activities. So we've designed it as DCF, obviously in liaison with the NHS, and that's our starting point. So it's within the body of the application form when you get to it. There's a question about the focus on adults. This looks to be a group that works with whole families. I think that's fine. So if you're a Home Start organisation, for example, most of us know the lovely Home Start charities, you may want funding for your kind of mums and tots group on a Wednesday afternoon. For me, the focus of a Home Start charity is supporting the parents with their well-being and their needs, and then by supporting the parents to have better well-being and mental health, there's a knock-on effect obviously on those children if they're more confident as parents as a result. So I think that would be fine because the people that you're really aiming to support are the parents rather than the children. If it's an activity that has been designed to what am I trying to say, that's been designed to address the needs of children, or where you're really engaging with the children themselves to try and, so I can think of one organisation that is all about the benefits of music for children, and they really engage with the children, and it's really the children's lives that they're trying to improve, then that wouldn't be eligible. So it's about who's your core beneficiary. But obviously for many parents and families, they can't attend your activity without their children because of childcare issues. So we're not going to penalise you if there are children in the room, as long as the outcomes you're talking about are for those adult parents. More guidance about referral organisations and networks. I think I want to leave that for Community Action Network. So if you feel that you haven't got a strong enough mechanism to reach the individuals we're asking you to work with, as I said, it could be by developing a formal referral route or signposting from other agencies, but it isn't the only way. So I think that's a longer conversation for you to have individually with Community Action Network about how might it be best for you to reach those individuals, and hopefully they'll be able to give you a much longer conversation about that.
Yeah, thanks, Ellie. I think that it's very dependent on what your specific activity or what you would like to move forward with. So yeah, I would contact the grant support email address,
which I've put in the chat, guys.
Thank you, Becky.
And how to join CAN as well.
There's only a few
and our training
more
sessions.
Yeah. There's only a few more queries, and then it'd be really nice for us to introduce Mark and to maybe hear from some of you if you're brave enough to ask your question online, because I'm sick of hearing my own voice at this point. I think
it's a very useful voice though, Ellie, and you've got incredible levels of information to share. So
I think we've covered that you don't have to ask for the maximum amount, whether it's a 2-year or a 1-year grant. Somebody applying for a 1-year grant may only need £2,000. Brilliant. Ask for £2,000. Absolutely fine. Ask for what you need. Be reasonable in your costs. It's kind of up to you, really. Does it help if we can demonstrate match funding? I think obviously, if you're asking for a contribution towards a project that has larger costs than we can cover, it will strengthen the application if you're able to tell us where the other money is coming from or where you plan for that to come from. it might not be match funding in terms of another funder. It might be that you raise income from client contributions, for example. But if you're only asking for a proportion of your costs, it does help if we know your plans to bring in the other income. I get this question a lot: are we more likely to be funded if we tell you we've got match funding? Not necessarily. You know, for some groups, especially perhaps for new and emerging groups that want to do a small pilot for the first time, you know, potentially we'd be more than happy to fund that in its entirety if it's a strong application. But if you do have match funding, obviously, yes, please tell us. Yes, I think that question was the same thing. Are you looking for interventions to be code specific or pan Dorset? Again, up to you. We are, you know, the money's from NHS Dorset, so the clue's in the name. You do need to be working with Dorset beneficiaries. So if you're on the border and some of your participants are Dorset residents, some of them are not Dorset residents, you would have to be proportional, unfortunately. So either ask for money for a piece of work that is only with Dorset residents, or what's more likely if you're on the border is that you're open to everybody in your area, in which case try and make a reasonable guesstimate. If 50% of your participants are Dorset residents, ask for 50% of the costs. But there's no preference. If you're working across all of Dorset, which is likely to be a 2-year grant, that's fine. If you're working in Bear Regis, equally fine. It's up to you and who you are, really. And training qualifications, yes, as I said, I think if it's important to your ability to deliver what you're describing, to upskill your volunteers or staff, then you can put in training. I think an application only for staff or volunteer training is perhaps less likely to be successful, because we do need to link the grants that we're giving to genuine impact on a service that's being delivered. So I think you would be better off including some staff or volunteer training within your wider costs. So you can say, these are the costs of working with the participants, but before we start that work, we're going to put our volunteers on a training course. So
Ellie, on this particular query, I think, as it's from Mindy at EDA, they actually deliver training as part of their offer. And so I'm wondering if if it means that can they deliver training qualifications as part of what their activity is for the groups? Which
it depends what the thrust is. So if you're providing a training course that is a back to work route, I would say that that's an employment project, not necessarily a wellbeing project. I'm sure delivering that training is providing a wellbeing outcome as a secondary outcome, but it wouldn't necessarily feel like a wellbeing. So I think it depends what the training is. Again, that probably needs a one-to-one conversation rather than what I can quickly answer.
Ellie, I do wonder, because I think people keep adding on, do we bring Mark in? He's only going to be able to hear for 20 minutes. And then if there are anything specific that you would like to speak to around the NHS specific questions, that'd be really useful. So I do. There
weren't that many questions when I started, and you're right. Okay.
No, they just, they keep adding. They keep adding. So Mark, are you in the room? I can't see you on my slides.
I am here.
Yeah, there you are.
Can you hear me?
Yeah, we can now, and we can see